Cardiovascular function. Cardiovascular function and cardiac output are determined by the interaction of several variables, each of which is ultimately dependent on biophysical mechanisms that regulate cardiac muscle and ventricular function. Cardiac filling and preload. Factors that determine ventricular volume, that is fiber stretch and diastolic blood volume and filling pressure, are sometimes referred to as preload. Preload is related to the filling volume and degree of myocardial stretch before excitation. Hence, it is one determinant of myocardial function and pump performance. Left ventricular compliance, inverse of stiffness, affects the atrioventricular pressure gradient, which determines left ventricular filling rate. A reduction in ventricular compliance with age remains unproved because its measurement requires the simultaneous determination of pressure and volume. The early diastolic filling rate progressively slows after the age of 20 years, so that by 80 years the rate is reduced up to 50%. This reduction in filling rate, demonstrated by echocardiography, radionuclide angiography, and Doppler ultrasonography, is attributed either to structural, that is fibrous changes, within the left ventricular myocardium, or to residual myofilament calcium activation from the preceding systole, which is discussed in greater detail below. Despite the slowing of left ventricular filling early in diastole, end diastolic volume is not usually reduced in healthy elderly persons. Because stroke volume at rest does not decline appreciably with age, the at-rest filling volume during each cardiac cycle is roughly the same regardless of age. And that is preload. Have a great day.